So, we're about to start the next session for SILMO Talks. I'm very pleased to be able to welcome our next speaker, Lana Delambre. Lana has spent the last 6 years working in post-16 education, first as a teacher who was later trained in special educational needs and disabilities, and she's now a pastoral manager looking after the safeguarding and well-being of vulnerable students. She's a freeman of the Worshipful Company of Spectacle Makers, and building on these foundations, Lana has developed and delivered continuing professional development programs for optometrists and for dispensing opticians. And Lana's work centres on enhancing patient experiences for neurodiverse individuals. So please welcome Lana.
Morning, everyone. I'm hoping we're going to get through everything today because I have time to myself and I've run out of time. But hopefully we'll see how we get on and we can cover what needs to be said. So today, this is what we're going to be looking at. So what is neurodiversity? And I'm going to touch upon a couple of neurodiverse conditions. There are many. And obviously, because of time constraints, we can't cover everything. But I will introduce you to some of the most common conditions that we usually see in the educational setting. And then at the end, I'll also give you some support strategies to how you can best support your patients. So what is neurodiversity? It's pretty much just a difference in an individual's brain function, okay? Someone who has a neurodiverse condition will be neurodiverse, whereas someone hasn't will be neurotypical. Here is the neurodiversity umbrella. As you can see, there are many conditions protected under that umbrella, okay? Obviously, because of time, we can't get through everything. One of the common conditions that we see in education is anxiety. So, for example, I have anxiety that's been diagnosed and medicated, so I am technically classed as neurodivergent. Tourette's syndrome, OCD, autism and ADHD as well. So they're the ones that we're going to be focusing on today. Now at the top, you can see a little rainbow infinity symbol. Now that is actually the symbol for neurodiversity. If you see this symbol, it doesn't necessarily mean that the person who's maybe wearing it on a badge or a lanyard is neurodiverse themselves. It could just mean that they're an advocate for neurodiversity. However, the sunflower, typically the sunflower lanyard, you might have seen a couple of people wearing them. Now that is an indication someone wearing that is neurodiverse. Just be mindful that you might get patients coming into your practice or on the shop floor and they might be neurodiverse but not necessarily wearing the lanyard. For example, I'm technically neurodiverse, but I don't wear one. Usually when a person does wear one, it's because they want you to know that they might need some adjustments, either in their examination or just, maybe on the shop floor, they might get overwhelmed, they might leave abruptly, and for you just not to think, oh, what have I done, what have I said? So just be mindful of that. There is also quite a common misconception that, everyone's neurodiverse these days, everyone's got something, or there's always a diagnosis. However, that's not the case. So I see it a lot in education as well. I get teachers coming up to me and saying, well, everyone's got something these days, so what does it matter? We didn't have that in my day. Well, actually, you did. The condition has always been there, whatever the neurodiverse condition, but it's the diagnosis that hasn't been there. These are some recent stats. They were all from this year. However, I'd take them with a pinch of salt. These are all estimates, okay? And they're estimates for both diagnosed cases and undiagnosed. In the UK, it can take up to 4 years to get an ADHD diagnosis. So often families just think, what's the point? But adults, so for example, if you've got maybe a more senior member of your family or a friend, they could be neurodivergent, obviously their whole life, but because it wasn't talked about, because it wasn't a thing, because it wasn't celebrated, again, they just think, well, I've lived this long without a diagnosis, so I just won't get one. It doesn't mean they're not neurodiverse. So it's up to you to actually see the signs. Most people will have traits, or they might have like little personality changes, triggers. So just be mindful that someone might be coming into your practice in the exam room or on the shop floor, and they might need some adjustments. Now, this is an example that I use when people say, oh, it wasn't a thing in my day. And it's One Flew Over the Cuckoo's Nest. So it was originally a book in the 60s, and then it got made into a film in the 70s. It's starring Jack Nicholson. It's a great film. If you haven't watched it, please do. And in the film, it shows a psychiatric hospital and patients and their stories. However, they are treated horrifically. Now, I have made a list of all the conditions that those patients in the book and film have. So things like schizophrenia, severe depression, anxiety, PTSD, epilepsy, a stutter, and homosexuality. Now, I've put our little infinity symbol next to each one that is classed as a neurodivergent condition. Every single one of those conditions, par homosexuality, is protected under the neurodiversity umbrella, okay? But that always wasn't a thing. Now, you've got to remember, when this book was made in the 60s, not that long ago, people didn't recognize these conditions as something to be celebrated because they didn't understand it, okay? There wasn't any research on it. People, you know, were scared, a bit like with homosexuality. They thought it was something that they needed to fix because they didn't understand it and because it wasn't celebrated. Now, some of the treatments that you see in the movie are things like electrotherapy, lobotomy, and medication. Now, again, we don't know how much research was put on that medication. But if you think now, if that was happening today, oh, they'd be struck off. That's not okay. Now, again, it's that sense of fear that all these people who maybe were struggling to go through their everyday life, they're not going to go for help because they're thinking, I'm going to have to go through these awful treatments or I'm going to be locked up. They don't want to do that. Now, I'm first going to start talking about medical anxiety specifically. Now, I have general anxiety, which a lot of people have now been diagnosed with, but also medical anxiety. Now, with medical anxiety, it's usually down to anything medical related. So it could be going to the doctors, hospital, a dentist, the opticians, things like certain smells, so that clinicky smell, fear of tests, equipment, symptoms. So, for example, you might have someone come in, for example, me. You're not going to know I'm neurodiverse based on looking at me because I don't wear a neurodiversity lanyard. So you've got to make the decision to look at me and think, are you okay? Have I had a change in behavior? So am I fidgeting? Am I getting a bit hot? Am I getting a bit withdrawn? So maybe do I appear rude, as in maybe I'm not answering you properly or I'm giving you one-word answers and things like that. Now, the impact that this usually has is missed appointments. So you might have patients who have made an appointment with you and they'll cancel like an hour before, or they just won't show up and they've not told you. Now straight away you might think, oh, well, I'm going to blacklist them because I've just wasted my time. I could have seen another patient. Please don't do that. Sometimes, you know, things happen. It might just be someone who's had to cancel because there's been an emergency or they forgot. However, just be mindful that there could be an underlying issue as to why they haven't attended that appointment. It might be that they're in the middle of an examination and they've just had to tap out and say, I'm sorry, I can't carry on with this, and they walk out. Please don't get offended if they do that. It's nothing to do with you, it's just because they've got overwhelmed. Now, we want to stop that from happening. We want your patients to come back to you every time because they feel comfortable. We don't want them to leave halfway through an examination. Now, story time. Throughout the PowerPoint, I'm going to introduce you to a couple of people who are going to speak about their own experiences in practice. However, I thought I'd just talk about myself. So recently, I went just for a checkup at a very popular branch in the UK. And first of all, the shop floor, really overstimulating. It has really harsh clinical lighting. I went in, it was really busy time, even though I had said to them, can I please have an appointment at a less busier time? It was still heaving. I went up to where the examinations room were, and every single chair, bear in mind there was only about 4, was taken, and it's in a really tiny, crowded area. I was this close to walking out, just because standing there in a room full of people, that really made me feel uncomfortable, and I thought, I've got to leave. But I didn't. I thought, I'll do my coping strategies, I'll breathe, I'll go on my phone, I'll distract myself. And then I got into the examining room. Now, I've been there a couple of times, and I have seen a different person every single appointment. So that's the same if it was a contact lens checkup, it was about 5 different people. If it was just a normal checkup, again, different people. So bear that in mind. There's no consistency there for someone, okay? You don't know who's going to be doing your examination. Now, during that examination, the gentleman that was doing it was actually great. Every single step that he did, he talked me through it. Now, he only found out that I had anxiety because he checked my records and said, oh, you're on medication. What are you taking citalopram for? And I said, oh, it's my anxiety. Now, he wouldn't have known otherwise because I wouldn't have told him. So you've got to be mindful of that. Check the patient records. Is anything on there? Are they on medication for anything? Ask them, okay? Because you're a healthcare professional. You have to know what they're on. But if they're not, obviously some people don't feel comfortable disclosing things. They might be on a waiting list and have been waiting 5 years for a diagnosis. So they think, oh, I don't have a diagnosis, so I won't tell anyone that I might need help or adjustments. Every single stage, he said, this is what I'm going to do, and this is why I'm doing it. Are you okay? And we had a check-in, we had a nice chat, but I always knew what was coming and why he was doing it. However, it got to a stage where he found something at the back of my eye, and he spent ages trying to get the perfect picture of this thing at the back of my eye, and straight away, my medical anxiety was going. I thought, right, he's found something, it's really bad, I'm going to die, I'll lose my eye, half my face is going to fall off, what am I going to do? I'm going to die a second time. All these things were going through my head, okay? Now, during that time, I'm distracted then because my mind is speaking a lot louder than he is. He gave it a name. To this day, I don't know what that name was. Afterwards, I said, oh, can I just take a picture of the picture? Because luckily, I have friends in the optical world that can maybe tell me I'm not going to die. Because he said, oh, I'm going to have to refer this to the hospital. Well, again, I've shut off. Now, you've got to think your patients might be so uncomfortable or so in distress that whatever you're saying, they're not registering, okay? Because their mind is so much louder than what's going on in the room. So be mindful of that. After the appointment, maybe have notes broken down for them to take away with you. Because like I said, to this day, I still don't know what he called whatever it was, okay? Luckily, I'm all right. I asked a friend, and they said, I'm not going to die. It's fine. It's a freckle. It's fine. So some supporting strategies for your patients. Have that reassurance all the time, okay? Even if nothing's really come up, just say, oh, well done, this is a really healthy eye, or, oh, it was a great examination. If they feel distracted, or if their body language has changed, or their personality is slightly changed during the appointment, again, try and distract them with something different. Be supportive, be reassuring. Try and have some consistency. So having that same clinician each time. I've still not been back for my checkup for this year because I don't know who I'm going to have. And although, you know, our discussion will be on my records, I don't want to have to go through that all again. So if you can, just have that consistency with all your patients because they will all benefit from it. Offer alternative methods of communication. So, for example, someone might not feel comfortable speaking to you or your staff members on the phone. So have other alternatives like email, text, or even a live chat feed if possible. Patient care. Now, for example, if maybe they haven't disclosed something, maybe because they haven't been diagnosed with a condition yet, but you have found that, oh, they have traits of something, maybe they've opened up about it. So, for example, oh, I'm on the waiting list for ADHD, and I fidget a lot, or I forget to eat, I forget to drink, I'm dehydrated. Things that could affect them, have that on the record, but then it might come up that, oh, I am on the waiting list for a diagnosis, but I just haven't got it yet. With their permission, write it down. Now, Tourette's syndrome. With Tourette's, it's actually more common than you think. Now, Tourette's can be divided into two categories. So the first is motor tics. Now, motor tics is basically anything physical. So things like maybe fidgeting, hair twirling, clicking, picking at the skin, even kicking, hitting, tapping, anything like that. Verbal tics is anything verbal. So whistling, or I don't know, making sounds with the mouth, singing songs, or even saying maybe inappropriate things. I will introduce you to someone in a second. Now, just be mindful that if you have a patient with verbal tics, if they ever say anything offensive, you know, racist, sexist, misogynistic, homophobic, transphobic, please don't react to it. You can react to it in a, you know, to sort of make them feel better, but don't say anything negative like, that's rude, why have you said that? Honestly, they do not mean it at all, okay? It is nothing to do with their personality, it is just a tic. Now, support strategies, obviously for you, don't panic. They're going to be more nervous and upset that they've offended you, okay? So if anything, if you do want to respond to a tic, just do it with a bit of humour, because they actually will respond better to that. Anything that makes them comfortable. Now, this is a patient experience, and she's actually going to tell you in her own words about her experience going to the opticians in a second. Now, this is Fawn. So Fawn was actually one of my students a couple of years ago. So when I worked in special needs, I was her key worker, so I supported her through college. Fawn is now at university. She's doing fashion and costume design, so she's done really, really well. However, she would be classed as a high needs patient. So her Tourette's was both physical and verbal, and they were really severe. To the point where she actually had a walking stick because her legs would give out, or she would get muscle cramps and need a rest. And also her vocal tics. Now, she was great at whistling the McDonald's theme tune. That was her tic. I won't do it because I can't do it, but that was hers. However, there was one incident where we were in a textiles lesson and the head of the department walked in, a male, and she said, "Malcolm, take your trousers off." Now, obviously, the whole classroom laughed. She was a bit embarrassed, but we had a laugh with her. He had a laugh. But she's a lesbian, so she really didn't want to see that. So this is what I'm saying is, whatever they say, they really don't mean it honestly. She doesn't want to see that, okay? She's not into that at all. Now, Fawn also had an autism diagnosis. So what you'll often find is your patients will have a dual diagnosis. It's often with anxiety, which Fawn also did have, or does have, should I say. So just be mindful of that. Now, she also had FND. Now, FND was actually later diagnosed while she was my student. So FND stands for Functional Neurological Disorder. Now, that was linked to her Tourette's. It just got to the point where her Tourette's was so severe that she started having seizures. So we had to put in emergency medical plans in place to help her if anything like that happened. Now, if you have a high needs patient like this, honestly, they'll know what they're doing, okay? Fawn wore the sunflower lanyard, and at the bottom, it had all her medical details, her medication, what to do in an emergency, so if she had a ticking fit, if she had a seizure, anything like that. So this is Fawn, so I'm going to play the video, hopefully it works, and you can hear her story.
Hello everyone, my name is Fawn. I am 18 years old. I have Tourette syndrome, anxiety, depression and autism, and of course I wear glasses. Today I will just be talking a little bit about my experience going to the opticians with Tourette syndrome, and I hope that this can help educate you guys and hopefully give your prospective patients a better experience when they go to the opticians. I first started wearing glasses when I was about 12 or 13 years old. I did always have issues with my sight, however I didn't actually realise I did, neither did the optometrists, because I really struggled going to the opticians with my anxiety, and being from a low class area as well, it can also be quite hard to just do that so easily. And then with my Tourette's, it does make it a lot scarier to go to the opticians. So, for example, it makes my anxiety worse because I'm like, oh well, what if I'm like being assessed on a machine and I hit it or I break it? Like, that is a really scary thought to me, even though that would never happen. They're literally metal or like hard plastic. It can be quite daunting. I have had a few negative experiences with that. So, for example, I've had optometrists who don't necessarily understand a lot about Tourette syndrome and how it works. Of course, they're not specialists in neurology, so it can be difficult. However, I think just some research into neurodiverse conditions in general can often be extremely helpful in helping to understand patients. And if you do come across a patient with Tourette's or another condition, just speak to them about it. Just a couple minutes before your appointment, it can really make a huge difference. So I am quite medically complex. I do have a lot of appointments all the time, and I find just engaging in that conversation, just being like, how can we assist you? What will help us, etc., is really helpful to me. Also in general, something that helps a lot of people with Tourette's when it comes to optometry and appointments in general is just taking breaks. So a massive thing for me that triggers my tics is like harsh lights, and of course in like appointments, you will get like flashing lights or something going into your eye, and that immediately triggers me and I'll start moving. Or, I mean, some of my tics are literally in my eyes, so then that can be really frustrating to deal with. But just breaks and patience with that can be super helpful. Maybe even offering a slightly longer appointment for someone with Tourette's, or tics in general, to be honest, because not all tics are caused by Tourette's. So again, people may have tic conditions where they might want extra assistance or some extra time in their appointment, and then it's great just to help them in general. A little bit more about Tourette's, just to help you kind of understand it a bit more now, is it is a condition which causes vocal and physical movements that are involuntary. It's to do with the brain sending messages to parts of the body at the wrong times. So it can be really tricky to not tic, if that makes sense, because your body's doing things that you're not trying to get it to do. So it's not something that someone can just turn off and on, and it can be heavily triggered by anxiety, stress, again, sensory issues. I struggle sensory wise quite largely, so again with lights, harsh sounds, stuff like that. So that's a bit about Tourette's and my personal experience, and I hope that can help you guys. Have a great day. Thank you.
So that was Fawn. What she said there will actually help all your patients who are either neurodivergent or neurotypical communicate, okay? Please keep that communication going. So every single step, have breaks. So Fawn there, that's her on a good day, okay? I've had her, ticking away, stabbed me a couple of times during textiles. That was fun. With a needle, not with a knife. So just be mindful that obviously when that anxiety or that stress gets triggered in an environment, that will enhance those tics, okay? So during an appointment, she might start off like that and then start ticking more and more and more. Don't be afraid to just communicate and say, are you okay? Would you like a break? And have that break. It might be that you let them go and back out into the waiting room, take a breather, and you see another patient. It could take that long, and that's okay. They're not going to be offended if you're saying, we need to call it a day, or let's have a break. If anything, they'll benefit from that. Have some consistency again with who they're seeing, because obviously the unknown is another trigger. So have someone that they know and who they're comfortable with. Offer late and early appointment times, okay, whenever it suits them best. Again, it depends on the patient, but in Fawn's case, we realised that any exams that she took, she would better perform in the mornings. Otherwise, throughout the day, she's going to be exhausted. Her tics might get worse, that stress, thinking, oh, I've got an exam in the afternoon, I've got an appointment in the afternoon. They're not going to perform as well. So in her case, an appointment in the morning would have been better. However, there might be some people, for example, I'll show you a patient case with OCD. They might actually benefit from something a bit later on because it takes them longer to get out of the house because they have some rituals that they perform. So just be mindful of that. Make sure that all your patients have that option to either have a certain time that they prefer or also a quiet appointment times as well. Now, supporting patients with OCD. Now, OCD stands for obsessive compulsive disorder. Now, there's a bit of a stigma with OCD that people like things clean. Yes, there is cleanliness to it, but again, it depends on the individual. With any person, especially a neurodivergent person, whatever their condition, it's not one shoe size fits all. You could have 10 people up here on the stage with anxiety, and they will have different triggers, different traits, and different coping strategies as well. So we have to be mindful of that. Now, with OCD, it's broken up into compulsions and obsessions as well. So with the compulsions, they might have certain rituals that they feel like they need to perform. I know sometimes I do it. My keys are in my bag. I know my keys are in my bag, but I'm just going to check it. I've checked my keys are in my bag. Now, before I leave the house, I'm just going to check again that my keys are in my bag. Sometimes I have to say to myself, I can see the keys in your bag. But someone with OCD, their brain's telling them otherwise. They're like, no, the dog stole your keys. Or no, no, your keys fell out. No, you never put the keys in your bag. Check-in doors are locked, so before you leave the house, did I text that person back? Or did I say something? Maybe I should apologise to that person who I said something to about 5 years ago. It's things like that. The brain is telling them things that aren't true. There are also obsessions as well. Now, some of these obsessions that patients may have can be really horrific. They might have intrusive thoughts like, I don't know, my family is going to die if I don't do this task. They might see things like, I don't know, a horde of spiders running across the room. They're not there, okay? But again, depending on the patient, you just got to be mindful about maybe how severe or how maybe emotionally deregulated they are. Now, this next video, it was by Treat My OCD, and I found it on my Instagram feed. Now, it's about the actress Jenna Ortega. So she was recently been in Wednesday. If you've not watched it, it's great. And she suffers with OCD as well.
Jenna Ortega recently opened up about her struggles with OCD.
I have pretty intense OCD, so I have a lot of, that's kind of my routine in terms of repetitive thoughts and counting everything multiple times and having to do the same action over and over. So sometimes my nights consist of like just being really exhausted and going up and down the stairs 6 times because I think that's what I need to do to make sure nobody breaks into my home.
And there's one tool she mentions that is a fantastic addition to ERP for anyone dealing with OCD.
I'm trying to meditate. And that's been a little bit of a learning curve, but I'm getting quite good at it now.
Even on days when she's busy, Ortega says she really tries to stick with her meditation routine because it helps ground her.
And I think I have to start my day that way. Otherwise, I don't know, it explains kind of my anxiety in recent years. So it's been nice to kind of deal with that in a peaceful manner.
While ERP is definitely the most effective way to treat OCD, meditation can act as a supplementation so that your ERP therapy becomes increasingly effective as you learn to separate yourself from your thoughts. So thank you to Jenna for bringing up this topic.
So what Jenna was saying there is that she gets really exhausted at night because that's when she has to perform her rituals in case, and if she doesn't do that, someone's going to break into her house. Now, this is another example of allowing different appointment times for your patients. So, for example, because she's exhausted at night, she might need a later appointment because she needs a lie-in, or she might need to get it out of the way so she doesn't have to worry about it later on. Because of that exhaustion, you could have things like, I don't know, dry eye, which is what we spoke about before, or they're not looking after themselves properly. So there are things to be mindful of. Now, this next person with OCD, I'm sure you'll all know, is footballer David Beckham. Now, David Beckham has discussed his experiences with OCD. So in an interview with ITV in 2006, he said, I have to have everything in a straight line or everything has to be in pairs. I'll go in a hotel room. Before I can relax, I have to move all the leaflets and all the books and put them in a drawer. Everything has to be perfect. Now, I understand this, okay? Everything has to have its place. Now, if David Beckham comes into your practice and it's a mess, he might just walk out. And it's not because he wants to be rude, but it's because he is so uncomfortable. There might be some people who just cannot be in that environment. They'll be overstimulated and they just have to leave. They might come in an exam room and your desk is just filled with random papers everywhere. There are pens scattered about, not in a pen pot, and things like that. Now, I mean, I'm sure he's lovely, so he's not going to say anything, but you might have some people who have to leave the room. They can't deal with that. Clutter equals chaos, okay? So just be mindful that you want your patients to be comfortable. Things like a messy desk or a messy shop floor, they're not going to come back. So you're going to lose customers. Now this is another quick video, and it is an example of someone with OCD leaving the house. Okay, now this is what I was saying, if a patient never turns up to your appointment, or when they show up, they're always late, there might be an underlying condition. You might have someone who has to go through all that in the morning before they even leave the house. Now, you've not seen that woman. She might have gone back in because she thinks a cat's stuck somewhere. And then once she's back in, she has to do that ritual all over again. Now, if you maybe have a patient who you've seen a couple of times and they are notoriously late, just give them a bit more breathing space. Don't blacklist them, okay? Or if maybe they just think, oh, I'm too late, I'm going to cancel my appointment last minute. Again, ask them, is there anything else that we can do to help? Are there any other adjustments? Maybe having a later appointment time could help them, or don't worry, come in when you're ready, okay? Don't rush them. Now, these are some things you can do. Now, often, in the more severe cases of someone with OCD, they might have those really triggering, distressing, intrusive thoughts that can really negatively impact their emotional well-being. Now, if that's the case, and you maybe see a change in behaviour in your patients during like the exam, or even on the shop floor, they could be just trying on glasses, and suddenly there's a change in their demeanour, that's because there might be a thought that's just popped into their head that something horrific is going to happen to them, or maybe someone they love, okay? Now, if that's the case, just try and distract them, but do it just, nonchalantly, okay? So maybe you're doing anything nice at the weekend, a bit like a hairdresser, or in good old British fashion, maybe talk about the weather. Anything to just slightly distract them from what's going on in here. Now, this grounding technique, this is what I use with my students who are in crisis, who maybe, they're so overwhelmed, they're not focusing on their breathing, and those thoughts are just taking over their emotion. So 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. It just helps to, 1, distract them because they're focusing on those grounding techniques, but also it helps lower their heart rate and just regulate that breathing, okay? So they can bring them back into the room. Communication, again, that is key, not just for your neurodiverse patients, but for everyone. Now, I've put on there to have a what you can expect document. Now, again, this would benefit everyone. Now, in that document, have visuals, okay? So have pictures of the shop floor, the exam room, your equipment. Maybe have a breakdown of what happens at a checkup or at a contact lens check. Maybe have lists of the facilities that you have. So is there parking? I know with someone with anxiety, I will Google every bit of parking and the area if I have to go to somewhere new, because if I go there, I'm running late, I can't find parking, I'm gonna panic, okay? So where's the parking, surrounding areas? Do you have a quiet space for your patients to go to? Do you have different exam rooms who maybe have, warmer lighting or less harsh lighting or things like that? Just have that information for them. And again, that's scheduling and flexibility. Please be flexible wherever you can, and don't penalise them if maybe they are, late or don't turn up to appointments. Now, I have put in the cleaning considerations because, you know, it is a factor of OCD as well. Cleanliness can be a thing. I have a student, she's actually not one of mine, but we have a duty rota. So if anyone's in crisis, they come to us, and obviously we sort them out. And I had one student come in who has OCD, and it's due to cleanliness. And a friend hugged her, and she just went in full meltdown. She came in crying. She was like, I can't breathe. She was scratching at her skin, at her clothes. She was pulling it. She started kicking tables. And that was because she was so in distress, because she thought, my friends hugged me, I feel really bad, but it's like I'm dirty now. And luckily, I had some antiseptic wipes, and she just wiped everything down, her phone, her clothes, her hands. But if that could happen. So with the cleaning considerations, obviously, since COVID, it has actually got a lot better. But have those antibacterial wipes available. Have that hand sanitizer there. With any equipment, I know every time I've been, they normally do it in front of me, where they'll maybe clean down, you know, the chin press or anything like that. That's great. Do it in front of them so they know it's been done. Or offer them to do it as well. And obviously have hand gel at the ready for everything. So on the shop floor, in the bathrooms, and in your exam rooms as well. Like I said before, more so for the David Beckham of the OCD world, clutter equals chaos, okay? So do make sure that everything is in its place, okay? It will help so many people, if anything, just to be less overwhelmed. Now, I'm going to move on with autism because I'm just a bit conscious of time. Now, in the past, autism was called ASD, which stood for Autism Spectrum Disorder. However, the autism community felt like the word disorder had a negative impact. So then it got changed to ASC, which was Autism Spectrum Condition. And they thought that was a bit too long as well. So just call it autism, okay? Now, in the past, again, there's been some stigma around autism. There was also Asperger's used to come under autism. Again, that's a negative. We don't say that anymore. Now, people with autism, again, it depends on the spectrum of where they are. So don't think, oh, they're autistic, so they won't be able to speak to me. That's not the case, okay? There are communication challenges that they could face. So you might have someone come in and they're non-verbal. I've recently had a student like that. She's just come in to us this September. I was doing her enrollment, and I didn't know that she was non-verbal. I just met her. And I was like, hi, you okay? Did you have a lovely summer? And she just gets her phone out and then starts typing. I thought, something's off. And then she just showed me her answer. That was it. So then I thought, oh, non-verbal. So then after that, just to make life easier, I asked sort of yes or no questions, or good, bad, just so it was easy, so she could nod her head or shake it, or thumb up, thumb down, things like that. You might get some people who just struggle with turn taking. So things like social cues, social norms. So they might interrupt you, or they might go off kilter and start talking about their favourite film, okay? If that happens, just be patient, all right? If anything, actually speak to them about it, because it will make them feel more comfortable. Now, sensory sensitivities. Now, this is what Fawn kind of talked about before. I mean, she has autism as well, so she has that dual diagnosis. Things like bright lights. Unfortunately, in any clinical setting, there's this awful, harsh light that, I mean, it's not good for the skin, but it's certainly not good in terms of a sensory overload. Now, I know it's difficult, especially when you are in maybe a clinic setting. You need that light so you can see, you know, your patients as well. But try and go for a more warmer tones. I recently had a friend who lives in Morocco, and he was saying that his son has got ADHD, and he's absolutely a rocket in the house. He doesn't sit down, he can't concentrate, he's got loads and loads of energy, but he's 7. So I said, well, it might just be a 7-year-old thing. But I said, you know what? Just try having warmer lights in your house. And that's what he did. So he went out and he bought some warm light bulbs, and he messaged us and said, he's a changed boy. He can focus, he can watch his show, he's a lot more relaxed. I said, well, there you go. So if possible, do have that warmer lighting. Loud sounds as well can be overstimulating. If you know that there's an equipment you use that is quite loud, just pre-warn them, okay? It might be a case of they need to use their headphones or earphones or something just to deregulate that sound. Often people with autism will also have anxiety as well. Anxiety does normally come with a lot of neurological conditions just because people don't understand them, and so there's just that added extra bit of anxiety. So be mindful of that. Now, behaviours and interests. So like I said before, there might be some patients who have such a focus and passion for certain subjects, and they might talk your ear off. That's actually quite good, because that means that they're comfortable with you. So just, again, maybe think, oh, I'm seeing this patient next week. We might need a longer appointment time. Don't rush them, okay? Repeated movements and behaviour. Now, I call these comfort tics, and we all have a little comfort tic. I know sometimes when I'm teaching, I'll be messing with my lanyard, I'll be messing with my jewellery, maybe a pen. I have someone in the office who clicks his pen when he's stressed. It drives me insane, but again, it's a comfort tic. But things like hand flapping, maybe doing that, snapping or hair twirling, things like that. They also have a preference for order and predictability. So if, I don't know, things happen, you're seeing a patient and you're ill that day, please let these patients know in advance. Any change to a schedule, whether it's time or something somebody they're going to be seeing, that could really trigger them. They might not actually turn up to the appointment, okay? I'm saying not just an hour in advance, maybe 24 hours or even a couple of days would be better. But if there is a last minute change in their appointment, again, don't blacklist them if they cannot go through with that appointment anymore. It's just because they're going to be too distressed to go through with it. I'm not going to play this video just because I'm mindful of time, but it was a documentary on in the UK about Am I Autistic? I'm sure there'll be clips on YouTube. I got this off Instagram, so if you want to take a look at it, it's by the Autism Chef. And it's basically about 5 or 6 people with autism, and they talk about their traits, their triggers, and their support strategies as well. Now, again, it's that idea of they've all been diagnosed with autism, but they're all totally different. And that will be the same for your patients as well. Now, this one I will play because it is very, very short. But it's that idea of maybe you have a patient who has more of a severe condition. Now, this young boy, he's about 16, yet he has the behaviour and presents more as a 10-year-old, okay? So this is a video taken by his mum, and it's on his way to school, and he takes a bus, but he's a bit nervous.
Oh, he did. He did. The paper's in his bag.
Fortnite. Come tell me about Fortnite. You were just playing yesterday.
Oh.
You just played Fortnite.
Go tell about Fortnite.
Come tell me about Fortnite. I want to hear. And then we'll do that. What was it?
She put a picture there for you. See?
I thought so. That's my boy. I'll get the paper.
Okay. All right, bye.
Okay, now, obviously that boy was so nervous about getting on the bus. And as soon as the bus lady was talking about Fortnite, which she knew that he loved, he was like, oh, this is okay, this is good. And then it makes him get on the bus. After a couple of sessions, she then starts putting things on his seat that are Fortnite based. Now again, you might have a patient come in and maybe they've not disclosed that they are autistic, or you might know and they do present in a similar way. Have a look at maybe what they're wearing, okay? Have they got an Oasis top on? Probably because they like Oasis, so talk to them about Oasis. Or maybe they have a badge of, I don't know, Harry Potter. Start talking to them about Harry Potter. And it can really make them feel comfortable and open up. Then every time they come and see you, it's going to get so much more easier because they think, oh yeah, I'm going to see that person who loves to talk about Harry Potter or who loves to talk about Fortnite. And it's just about making that environment comfortable for them. Okay, so some support strategies that you can do with your patients. Again, it can do for all of your neurodiverse patients as well. If maybe they do have communication difficulties, use pen and paper, okay? Or like that student I was telling you about, use the phones. In more severe cases, there is an app that some mute patients use, and it's like an AI app. So what they do is they pre-record an AI bot who gives them answers. So for example, if you, I don't know, are asking someone like, how was your day today? They will have pre-recorded that, and then they can just make you listen to it on their phone. Same with things like answers. So they might actually click, how are you? And then you can say, oh, I'm really fine, thank you, how are you? And then they can answer, okay? So there are strategies that people do put in place. When maybe you're in an examination, things just like tapping. So 1 tap for yes or better, or 2 taps for no, worse, no taps for it's the same, okay? Just really simple strategies that you can put in place. Do acknowledge the patient. Just because they maybe struggle talking to you, don't just not talk to them, okay? If anything, it might make things, 1, awkward, but 2, it might make them upset as well, like, oh, they don't matter because they maybe don't have a voice. You be that voice for them, okay? Sensory sensitivity, so try dimming the lights where possible, especially on the shop floor. I know you'll want to, you know, demonstrate all your lovely equipment and eyewear. However, if you have maybe a little quieter room or area that these patients can go to, that would really help them. When physical contact is necessary, I mean, like everyone, communicate that and just ask that they're comfortable with it before going through with it as well. Now, a sensory box. I do have one at the front. I don't think I've got time to properly demonstrate it, but if you want to have a look at it after the talk, then please come and have a bit of a gander at it. With a sensory box, I have one of these on my desk at work. We have a lot in the classrooms as well, and it's actually for everyone. I have staff members and neurotypical students who will sit down at my desk and they'll start playing with a fidget toy. It's not that they need it, it's just because they're interested in it. But it has been proven to help, 1, regulate focus, but also helps with breathing as well, and that kind of grounding technique. So things like fidget toys, there's loads in the box. A weighted blanket, so maybe during the exam, if maybe you've got someone like Fawn who's a bit in distress or they're ticking a lot, have that weighted blanket over them. Noise cancelling headphones or earbuds, not great for the environment, but the headphones are a lot better. Oils, so maybe have some lavender sort of circling the shop floor, something calming, and have visual aids as well. Now, unfortunately, we've not got a lot of time for ADHD, but I'll try and go through as much as I can. Now, with ADHD, again, it depends on the person, but it comes under 3 categories. So you've got impulsivity, so someone who is obviously really impulsive. A lot of people with ADHD are not great with money. Because they just think, oh, it's fine, I've got it, I'll just spend it. But they won't think, do I really need it though? Food as well, they're really impulsive, they get hungry easily. You've got hyperactivity, so things like fidgeting, difficulty sitting for like long periods of times, and inattention as well. So with inattention, you could be going through some instructions, they've not heard that. And it's not because they're being rude, but it's because they're thinking about something more fun, okay? Or they might cut you off. And again, they're not being rude, it's because whatever has come into their head, they just have to share it with you straight away. Otherwise, they're gonna think, I'm gonna forget, okay? Now, if that ever happens, again, don't react to it in a negative way. React to it just more with a bit of patience, okay? If you know you have got a patient with ADHD, maybe you know that you can allow extra time during an examination and things like that. Now, this was a patient experience with Lyndon. Now, I've not got a lot of time, so I can't really play his story. However, I worked with Lyndon when we worked in special needs. Now, Lyndon was 30 when he got his ADHD diagnosis. He had traits at school, but again, even when I was at school, it wasn't talked about, so it wasn't really well known. It didn't mean he didn't have it, he still had the traits, but he didn't necessarily have the support in place that he needed. He also has anxiety and depression, which he's medicated for, and he gets related panic attacks. Now, the first time I met Lyndon when he joined our team, first thing he said to me was, I'm really sorry if I come across as rude. And I was like, what do you mean? And he said, well, I might cut you off, or you might start speaking and I'll go on my phone, or I'll start replying to an email. But I said, I'm on the waiting list for ADHD. And I said, don't worry about it. But it was actually quite sad that he thought that he had to apologise for acting like that. Often these patients will have poor time management and poor sleep. So again, just be mindful if they're not so great at keeping appointment times. Again, because of that poor sleep, they might perform better at a later appointment. Otherwise, in the morning, they're just too exhausted. I will introduce you to Lyndon. That's the lovely Lyndon. But we can't see what he has to say, though. Sorry, Lyndon. Just some strategies to best support your patients. So clear communication. Because you might be going through instructions, because what's going on in their mind is so much louder than what you're saying, they might miss things. So maybe have instructions written down for them, or repeat yourself. Don't be afraid to also give them prompts. So I used to be a prompt during exams, because a student would be in the exam and then they'd start looking around the room. And it wasn't because they were cheating or looking at different people's exams, it was just because they were getting distracted, okay? So be like, oh, let's keep on task. Or shall we have a break? Shall we have a breather? That's okay, all right? Communicate that with them. Now, these are just some practical tips actually for your clinic. So things like your environment. If possible, have an area that's a lot more quieter than the rest of the practice, okay? Just because if they do get overwhelmed or overstimulated by loads of people, sounds, lights, colours, they can have somewhere that's a bit more sensory friendly. Communication, so again, just keep that communication going. Don't be afraid to ask them what they want and what could best support them. Flexibility as well. So again, looking at those appointment times, don't be afraid to say, oh, let's have a break, or we might need to just end it there, but we'll come back at a later date, okay? They'll actually feel less pressured, so it does benefit them. And you're not stressed either to think, oh, I've got about 5 patients waiting, I'm running out of time. Now, these are just some other things you can do just to add into your clinic. So the Himalayan salt lamp, we have a couple in our office. It has been known to decrease stress, improve mood, air quality. And again, just that warmer lighting can really create that relaxed atmosphere. Living plants, okay? Those colour charts, so earthy tones, greens, sort of warm tones, will help relax your patients. It will also benefit your staff as well to be more productive as well. Now, I'm really sorry we don't have time for questions. However, I am going to be wandering around, okay? If you would like any slides or any questions or anything, that's my email, okay? I also am on LinkedIn as well. So if you want to take a picture of it or if you want to come and see me just afterwards, I've got my sensory box, then please come and see me. All right, thank you.